Hello, I'm Bob Sarkany, lead author of this study on facial ultraviolet exposure in patients suffering from xeroderma pigmentosum. We did this study because we look after many xeroderma pigmentosum patients who, because of their inability to repair damage to DNA caused by ultraviolet, develop skin cancers mainly on the face from early childhood onwards, and these often cause death in early adulthood. The main means of preventing these cancers is absolute and lifelong photoprotection. Since no one has previously objectively estimated the ultraviolet exposure of the face in any disease, we first developed a method to do this. Our method uses a wrist-worn ultraviolet dosimeter along with an activity diary in which patients record the face photoprotection method they're using while outside. We used this method to study the ultraviolet exposure to the face in 36 patients over a 3-week period in the summer. We found a dramatic variation in ultraviolet exposure to the face between patients, the difference between the dose in the best and worst protecting patients being over 100-fold. The worst protecting patients had exposure levels similar to those in healthy adults. We also found that adult and children patients had almost identical face exposure, but achieved by entirely different means. The adults protecting less well when outside, but going outside less. The children going outside more, but protecting better. The poor adherence we have identified in some patients is likely to be causing skin cancers and reducing lifespan. We are separately reporting our work identifying the factors associated with poor protection in these patients. And these have turned out to be potentially reversible psychosocial ones. So we have designed a behaviour change intervention and are currently testing this in a clinical trial. The differences in behaviour identified between adults and children means that medical advice in xeroderma pigmentosum needs to focus on timing and duration of time spent outside, as well as improving photoprotective measures when outside. Our methodology for objectively estimating facial ultraviolet exposure may also have wider application in other diseases, particularly studying non-adherence to photoprotection in patients at high risk of non-melanoma skin cancers. Thank you.